Thinking about these feelings got me in my feelings, but I'ma be alright. Talk to Thinking about these feelings got me in my feelings.
Hey, well, welcome everybody to the New Jersey Psychological Association's Power of the Spoken Word series. Today, we want everybody to know that NJPA developed these podcasts as a resource to the community. We want to make sure we can inform everyone about the topics related to psychology and psychologists in New Jersey. And we really want to make sure that the people who love, live, work, and play in New Jersey get some relevant information. So we want to welcome these three fabulous people because you are on our very first podcast. And you've experienced all the things related to being first. So I appreciate it. And welcome. And today we're going to be talking about COVID. But before we do that, I want to introduce everybody. So first, I want to start with Dr. Janie Feldman. She's a licensed psychologist who's been in private practice for over 25 years, providing therapy to children, teens, and adults. She focuses on anxiety, self-confidence, and relationships issues are her common treatment focus points in her work. She enjoys making media appearances, so we welcome that. And she also creates inspirational posts. And I know we're needing them a lot this time. And in her spare time, and I'm always amazed when people say this, Dr. Janie says she enjoys running, Zumba, and fostering rescue dogs. Now, this was impressive to me. She's fostered well over 100 unwanted dogs and puppies until adoption, but has only adopted 2. That's impressive. I would be looking like a hoarder. I don't know if I can
You know what? Dogs make excellent therapy aids, and I bring my own dogs and my foster dogs to the office all the time, and people love them.
Wow, that's really good.
Especially right now, having a warm, furry friend is one of the best things we can have.
I can imagine. So now on to Dr. Susan McGrody. She's an associate adjunct professor at Rowan School of Medicine.
We lost you, Daniel.
Oh, say it again. You lost me?
Yeah.
Okay. Let me try this. Am I back yet?
Yeah.
I'm back now?
Mm-hmm.
Okay. So prior to joining Rowan, and correct me, yes, you are a tenured professor at Chestnut Hill College, right? Okay. On a doctoral program in clinical psychology. She is currently the director of professional affairs of New Jersey Psychological Association. And Dr. McGrody loves paddleboarding and in the warm weather spends hours paddling and exploring the bays and inlets around Ocean City, New Jersey. I think y'all some athletic people. Because when you hear what Pat does, I'm like, whoa. And also, last but not least, is Dr. Pat Pryor. She's an associate medical director at Rutgers University Camden Student Wellness Center. She's involved with the New Jersey College Health Association, American College Health Association, and the International Society of Travel Medicine. She enjoys lap swimming and swims more than 50 miles in the summer, which I said you must use vacation days for that. Because I
No, I don't. Oh, I never do. I just do it.
We're like 50 miles. Okay. Now, the reason I decided to do the fun facts with everyone is because it's one of the things that we're missing in this age of COVID-19. The idea of that social connection and that we need to be entertained, amused, and engaged with each other. So I wanted to make sure we focus on that because today we're really going to focus on identifying some of the practical issues that people may be facing during this pandemic, and also thinking about how we can help people think through some of the new normal issues, particularly as we're working in this state of transition from where people are talking now about shelter in place ending at some level and reducing some of the social distancing restrictions to what life's going to be like when we're engaged. So I wanted to start with Dr. Pryor and see if she could just give us a basic and brief understanding of what is COVID-19.
Okay, so this is the whirlwind tour of COVID-19. We're all somewhat familiar with the current outbreak of COVID-19. The understanding of the virus is an ongoing process, and I'm going to talk about what's current, but it is a changing environment, so it's constantly changing. COVID-19 is an RNA coronavirus. There are several coronaviruses that are usually circulating, causing typical upper respiratory infections like colds. COVID-19, this outbreak is thought to be more contagious than the seasonal flu that we usually get. It's spread through respiratory droplets, in the air, coughing or sneezing, and on surfaces. There has been a study looking at how long it's viable on surfaces, and it has remained viable on cardboard up to 24 hours, copper 4 hours, plastics and stainless steel up to 3 days. There are also several studies which show documenting asymptomatic and pre-symptomatic spread of disease, which it can be contagious for a day or 2 days before symptoms develop. The CDC just expanded their list of symptoms associated with COVID-19, and they are fever, cough, shortness of breath, chills, which may be recurrent, myalgias or muscle pain, headache, sore throat, new loss of taste or smell. And there are other symptoms sometimes associated, like diarrhea, and in the elderly, especially change in mental status. Management of the disease will include testing, self-isolation, contact tracing, and hospitalization when needed. The testing performed is a reverse transcription polymerase chain reaction test for viral RNA, which is done by a nasopharyngeal swab or sometimes a throat swab, and these must be performed by providers. There are now saliva tests, which are done through Rutgers University. They developed this, and the military as well. And they can be self-administered, and there's a quicker turnaround with the testing. And also, there's not the risk to healthcare providers performing. They don't need to perform the tests. There are antibody tests to COVID-19, which have been done in prevalent populations, which to show the incidence of the disease or attempt to. In California, Santa Clara, they showed less than 5% of the population had antibodies. And recently in New York City, it was up to 15% of the population had antibodies to COVID-19. What's unclear is how long this immunity lasts, though. So that will be determined. Who should be tested? The priority is given to first responders, healthcare workers, hospitalized patients, and after that, patients with high risk of complications. And then whoever providers recommend. But there is still limited testing. It's not fully available, so not everyone can get tested. And there is on the New Jersey Department of Health site, there is a link that shows all the testing sites in New Jersey. It's estimated that 80% of those infected with COVID-19 have mild disease. And for them, the treatment is just symptomatic. Rest, hydration, acetaminophen, avoid contact with others, and avoid sharing plates, drinks, towels, bedding, and if possible, using a separate bathroom, and watching for signs of worsening disease. The CDC and New Jersey Department of Health each have signs and symptoms, and you can check to see if your signs are associated with COVID-19, your symptoms rather. In those with severe illness, COVID-19 can affect all organs: lungs, heart, liver, kidney, vascular system. There is a risk of blood clots, and with that, strokes even. These are the people at risk. The risk factors are greater than 65, immune system disorders, cardiovascular disease, diabetes, kidney disease, obesity, liver disease, and of course, homeless and incarcerated populations. More incidents. The medications that are currently being looked at have already been approved for other purposes. So they're just trying to see if they would work against COVID-19. They include antivirals, immune modulators, interleukins, hydroxychloroquine, which we've heard about, and convalescent serum from people who have previously had the disease. And also vaccines are several vaccines are being studied now, and but realistically 12 to 18 months before the availability to the general population. And so to protect yourself, wash your hands as frequently as you can. And if you don't have that, hand sanitizers greater than 60%. You want to clean and disinfect frequently touch surfaces like keyboards, everything else. And personal distancing greater than 6 feet. Wear a cloth mask. It's required in New Jersey and PA. And when in social settings, especially when you can't social distance, right? So shopping, pharmacies, if you live in a city, it protects others and somewhat yourself, and also shows a sense of community, right? That you're buying it. Don't touch your face, and don't go out if you're feeling unwell.
All right. Now, I guess thank you. And we're here understanding like sort of the medical consequences. And what I want to really have Dr. McGrody and Dr. Feldman talk a little bit about, particularly for practitioners, what are the consequences that people may be facing from a psychological perspective, particularly, what people may be experiencing in their practices and work in hospitals and other settings. So any observations and thoughts? So when Janie pops back in, we'll start with her. We'll start with So, Dr. McGrody, you can talk. You can go next. Okay.
So the general thing that I'm observing is a lot of teamwork. Like you said, Dr. Pryor, wear masks to demonstrate, teamwork and community respect. And I think if we look at the big picture, there's been a lot of teamwork and a lot of people coming together. And I feel oftentimes we're seeing people, put their best self forward and manage their anxiety. However, there is a lot of anxiety out there. And I feel like as quarantine has gone on, where that anxiety, as often happens, is coming out as anger and frustration. And I think that that's a threat to the sense of community that has been building, and something that I think as practitioners we're going to have to manage, because that anxiety and that frustration can obviously affect people's mental and physical health.
Welcome back, Dr. Feldman. Listen, we're going to work it out. But going back to that question, I'm not even sure if you heard me, but we want to talk about some of the psychological or consequences and those we may be facing in our practice. So can you give us any thoughts and observations?
I absolutely can. And please forgive me of the technical difficulties I just encountered, but hopefully smooth sailing from here. So again, forgive me, Dr. McGrody, if I'm repeating, but there's just been a tremendous amount of stress and anxiety based on the uncertainty of what's happening and the conflicting messages and the frightening messages. And there's been a major disruption in our lives. And so while we're all kind of in the same boat, we tend to think it's also very different for some people, because some of us are living alone and some of us have families with young children or school-age children. And I think there are just so many challenges facing people on top of the uncertainty and concern for loved ones, whether they're frontline workers or out there doing jobs that put them at risk or their own self. So the anxiety has really been ramped up to the point where it's affecting people physically. And so I'm seeing a lot of people with sleep difficulties, including having strange dreams and troubling dreams. And so there's just a lot of distress and discomfort. And at this point, people are also feeling edgy and irritable and really frustrated in this ongoing situation.
Wow. And that's interesting, because I was thinking about some work around secondary traumatic stress, moral injury, how those pieces may be popping up for a lot of the folks who are in practice now in the healthcare. And I'm also thinking sort of what everybody's been talking about is like, we're not exempt from the consequences. Right now in New Jersey, I think it's like well over 113,000 cases in terms of positive, and I think a little bit over 6,400 deaths. And it's starting to get really personal in terms of, I think, our work, not just with our clients, but, also with each other. So, and I'm thinking about all the consequences around having to deal with grief and loss, and some of those struggles around problem solving and not maintaining a negative problem solving set and getting stuck. So I'm also wondering, I'm gonna start with you, Dr. Feldman. What suggestions would you offer people if they're experiencing some of these troubled experiences or emotions or thoughts, or if they know people who might be experiencing that? And I'll be asking everybody to join in with that too. So I'm gonna start with you, Dr. Feldman.
Absolutely. And one point I'd like to just make before I go there, if it's okay, the frontline workers are also feeling a sense of helplessness and a sense that in working so hard for others, there's a selflessness and a stoicism that's driving the frontliners. So they're working so hard around the clock. I think when things settle, as they're starting to hopefully settle, their own awareness of their great levels of distress is going to send them more seeking help. But right now, I think they're right on the front lines, just going and helping the best that they can. So to answer your question in terms of what we can do, taking care of ourselves, self-care is extremely important. So in taking care of yourself, you want to have a routine that gets you up and out of bed every day. You want to be doing things that have you active, moving, connecting, enjoying nature when you can get outside, even for a walk in the yard, something that brings you outdoors. And with the internet, we have the ability to connect with different people now, and there's a whole lot of social networking going on that I think is very healthy. And you can also take virtual tours through museums, and you can take up yoga online. There's so many free courses now that are available that you can engage in lots of ways, but finding moments of positivity, finding moments to connect, moments of meaning, all of these things will really help us get through the really difficult moments. And just being aware that we can get through and this will not last forever, I think it's extremely important, and holding on to that hope. So we'll get through to the next day.
Okay. Dr. Pryor, you have any additional thoughts?
Well, no, I agree with that. And I think it's important connecting with other people, like you said, and getting outside. I keep telling them, like, okay, wear a mask, but get outside some, you just to get some light, be outside. The other thing with the frontline workers, I think I have a brother who's been caring for ICU patients he's a nephrologist. So he's been caring for ICU patients with renal failure from COVID. And he's been living separate from his wife because they have a nearby lake house. So so in addition to working hard and being that you're a lot of them are separated from their families, which is even harder because they're afraid of, spreading the disease to other people. So, but I think one thing that healthcare providers in general have problems with is that we're used to, seeing a problem, assessing it, and then forming a treatment plan. And this has not been possible with this because it is a constantly changing situation. So, while it's hard for everyone to hear that too, it's been hard. Like every day I'm looking at sites to try and see, okay, what's new? What are the new guidelines? What else are they doing? So it's interesting, and stressful, but yeah.
That's true. And Dr. McGrody, any other thoughts?
I think that the recent suicide of Dr. Breen is, I think there's many lessons that we can learn from that so that her death has meaning. And the culture of medicine is historically very stoic and keep going. And when I interact with the physicians that come across my path at Inspira, I have taught them something called let's get gritty with it. And so we know that we're in Philly, gritty. We know that avoiding your emotions is the worst thing you can do. And it is one of the factors that's most associated with converting to PTSD. So I encourage them to use a minute mindfulness, like Headspace has 1 minute mindfulness that are awesome. And then just ask yourself, what am I feeling? And there's research that just by naming your feelings, you downregulate your emotions, which is so healthy and such a great part of resilience. So I feel like giving people a skill where they can, look at their emotions and not get overwhelmed. All you have to do is just name it. I just want you to start with that and like get gritty with naming it. And, I give them an emotion wheel or take a picture on their phone. And, it's quick, it's dirty, it's doable. And I think healthcare workers can benefit from that. But I also find myself doing that, as I start to get overwhelmed in my work, like, okay, 1 minute mindfulness, and then get gritty with it, and then get back to work.
I like that. And I think, like you say, everybody's focused on the self-care and then all of the new realities. So what I'm going to do, because I know we're running short on time, but I wanted to focus on, I think one of the major issues that are like in the air right now is this movement from shelter in place to restrictions and social distancing. And I know it's creating a lot of stress, and it's a lot of mixed messages, and it's a lot of different parts of the country sort of responding to it differently. New Jersey laid out a 6-point plan, and I think the governor mentioned that the 6 points to consider are a sustained reduction in cases, expand testing capacity, robust contact tracing, safe and secure places to isolate and for quarantine sort of methods, a responsible economic start, and ensuring New Jersey resiliency, that last word got me. And I'm wondering, as you're thinking about it, what 2 or 3 points would you want to have people to keep on their radar to really ensure that New Jersey becomes resilient from this? So let me start with Dr. McGrew.
So I go back to don't avoid your emotions. Find some way to talk about them. Like maybe give yourself a time every week that you can connect with them. Stay connected with people through social media and other safe ways. And for many people, I think there's a theme of a return to spirituality. And, we as humans have coped with using spirituality for as long as there's been humans. So that might be something to explore at this period.
I like that. Dr. Pryor?
Well, I think something that we've looked at like how to return to seeing, like we are still seeing some patients, but because we can't do telemedicine for everything, but at the same time, I think, so we've looked at ways to return towards that. And it's interesting because I feel like it's allowed us to be creative with things, so because it's not going to be like night and day. So, it has to be a gradual, safe process. But I think it's allowed us to have some creativity and look at ways of how we can best, take care of people and everything. So I think that it helps with our resiliency actually to all be involved in, how can we do this best process for everyone? So
thank you. And Dr. Feldman.
Well, I appreciate these points. I think creativity is actually essential in having an outlet, having something to do with this energy. So bake or cook or build something or learn how to do that. And in the time of transition, I think it's going to be more important than ever to balance the amount of information we're taking in, because we really can get overloaded with all the messages out there. And so you want to set some limits in terms of just how much media information and news that you're going to get, how much time in your day, because I'm finding the people who spend more time following the news also have higher levels of stress. So you want to balance that, like balancing everything. And when you put things into a perspective and you have mindful activities, like I like that get gritty idea, and just finding a name for your words and doing things like journaling or meditating or just having a quiet moment to take a breath. Basically, we just want to take care of ourselves. And when we've got good self-care, when we're taking care to eat as healthy as we can and to hydrate and get good rest, that's going to carry us through these really difficult times and get us ready for re-entry, which I know we're all ready to do.
And the last thing we're going to do is a quick lightning round to give practitioners your go-to resources during this process. So I'm going to start with Pat. If you could give maybe your top 2 places to find information for practitioners.
Okay, I'm going to do, I have more than 2, but so the CDC, obviously, because that we all have to follow what they're saying medically. New Jersey Department of Health and the NIH has some good guidelines as well. And Johns Hopkins has a good corona map where it's located in this state, you know, where the states, what counties, things like that. So
Great.
numbers.
I'm going to save Dr. McGrody for last, but Dr. Feldman?
Well, in terms of my go-to for good self-care, my favorite app is called Calm. And every day they have a new meditation. All their meditations are around 10 minutes or less. So they're short and easy to do, and they're very inspirational. And I look online for other sources of information, other psychologists, and of course, NJPA. But I'm looking for sources of inspiration and also humor, because having some time to laugh, it works. It feels good. It's fun. And getting other people to laugh or sharing humor, I think, are really positive things that can get us through. Those are my go-tos.
Okay. And Dr. McGrody? Oh, you got to unmute yourself. You got to
So for reliable information, I guess I'm not supposed to say TikTok.
I love it.
So I would echo NJPA, and APA has some great practice resources. NJPA just redid the website. The COVID stuff is really, really clear. And I love Headspace. It's free to healthcare providers. And if you YouTube it, you can find a lot of free stuff. And it's just so accessible for many people.
I want to say thank you, guys. And I want to say my go-to resource is facts. And, you know, since the spike of people calling in poison control lines, I will want to say, you know, please do not use disinfectants to treat.
On you. Right, on you. There's surfaces.
So facts are my go-to resources. And again, I want to thank Dr. Pryor, Dr. McGrody, and Dr. Feldman for helping us complete our first NJ podcast. And I know Dr. Pryor and Dr. Feldman will be joining us for our next segment for the public. So again, thank you guys. And I'm really looking for the polished look. So as soon as the link is up and out, I'll make sure you guys will be the first one to get it.
Thank you so much.
Bye-bye.
Thank you, Dr. Lee.
Okay.
Disclaimer. This podcast is intended to provide members of the general public with access to information regarding the potential benefits of psychological treatment. This podcast is not intended as a referral service, an advertisement of services, or a solicitation of business, and is not intended to create a psychologist-patient relationship between any of the podcast participants and the listener. Any individual status as a participant on this podcast does not suggest recommendation of any such individual as a provider of services by NJPA or its affiliates. Thank you for listening to the NJPA Power of the Spoken podcast series. Remember that psychologists can provide meaningful insights to improve our understanding of things that matter in life. As experts in human emotions, behavior, and functioning, psychologists work with you to bring you the positive changes you want in your life. Be sure to visit the NJPA website at www.psychologynj.org and follow NJPA on Facebook, Twitter, Instagram, and LinkedIn.
Thinking about these feelings got me in my feelings, but I'ma be alright. Thinking about these feelings got me in my feelings.